Hello, my name is Wes Hayden, President and co-founder of CoachCare. In this video, we will talk about how to make your remote patient monitoring program profitable. Now, RPM has many benefits for providers and patients, including improved outcomes and a lower overall cost of care. But some providers ask us for guidance on how this works profitably from a business standpoint, and we'll get into that today. So we've seen our clients create profitable RPM programs using three main models. And I will walk you through these and then show you the actual numbers for each model. So first is what we call our in-house monitoring model. This is where your own staff does the monitoring for patients. And I'll show you the details in a minute, but this is ultimately the most profitable model. However, you have to manage the staff, and as the program grows, you may need to add more staff, so that can add complexity for you. Next is our limited monitoring model. So this is similar to the previous model in that your own staff does the monitoring, but this is for organizations whose patients require less oversight, so there's much less monitoring to be done. So you will utilize the device supply codes for all of your patients, but only use the time monitoring codes for a small proportion of patients. So this works well if your patients don't have complex conditions, or if you don't have any staff to complete the monitoring time each month. And the benefit of this model is that it's very easy to implement and it's pretty hands-off, but the profit opportunity is a little bit lower because you're not using the time monitoring codes very much. However, as I'll show you in a little bit here, it's still pretty profitable. And last but not least is our outsourced monitoring model. So this is where our outsourced provider partner actually does the monitoring on your behalf. Now your team introduces RPM to the patient, but then they refer the patients to us for setup and ongoing monitoring. We take it from there. So this is hands-off, like the limited monitoring model, but the profit opportunity is a bit higher because we utilize those time monitoring codes a bit more. So this option is a good mix of simplicity and profit, but you have to make sure you're comfortable having outside providers monitor your patients. So now I will demonstrate the profit opportunity for each of these models using our RPM profit calculator. You can see a screenshot of that here. And if you're interested in learning more about how these numbers look for your specific organization, we'd be happy to go through it in a brief Q&A call. So let me open the calculator and walk you through each of these models. So here you can see our RPM calculator. And first, let me walk you through the different aspects of it. So first, we make an assumption around the number of new patients that are being onboarded to the program each month. And here we've assumed about 100 new patients per month. Pretty typical for our clients. And next, we've made an assumption around when the monitoring will stop for those patients. So how long is the care plan? Is it a 3-month care plan? Is it a 4-month care plan, 6-month? In many cases, it could be longer, but we're just setting some basic assumptions. So we assume a third of the patients are for 3 months, a third are for 4 months, and a third are for 6 months. So you can see here that the patients roll on, and then eventually as we get towards 3, 4, 5, 6 months, they start to roll off. So that's that first set of assumptions. Next, what we have here is assumptions around the revenue side of the equation. So this is showing whether basically each of the codes that are used. So here we've got our assumptions for 99453 and 99454 and 99457, and then finally the 2 units of 99458. So you can see the different reimbursement rates that we have here, which are all based on Medicare national allowables. And then next you can see our assumptions around the percentage of patients that we're going to actually bill for those codes. And this is an assumption that's going to vary quite a bit based on the different types of models. So we'll go through that in a minute. And then lastly here, we have our assumptions around the costs. Give me a moment, I'm gonna make this smaller so you can see more of the screen. So the last assumptions around the cost. So here we have our base license fee per month, and then we have our per patient fee that's just tied specifically to RPM, as well as the device cost for that RPM patient. And then we've made an assumption around the amount of staff time that's required and some assumption around the cost. So we just want to give you a full comprehensive picture of what goes into delivering the service. And then at the end of the day here, we have your profit opportunity for the practice, fully loaded profit and profit margin. So now that we've gone through those, let's touch base on each of these three models that we've talked about here: in-house monitoring, limited monitoring, and outsourced monitoring. So let's start with the in-house monitoring option. So what we have laid out here is actually a very good assumption of how in-house monitoring could work. So we've assumed that 100% of the patients get monitored for at least 20 minutes, which is a pretty fair assumption based on our experience. And then 80% of them get up to 40 minutes of monitoring in the month. And then only 60% of them get up to the full hour of monitoring. So that's what we've assumed in an in-house monitoring model, which is very comparable to what many of our clients have seen. And then, as I said, we've assumed the staff time that's required behind that. And what you can see here is that the profit opportunity grows pretty substantially, so both in terms of absolute dollars as well as the percentage margin that we have here. So if we just use the baseline of, call it profit, in month 3 after a brief ramp up period, here we've got $33,000 in the first month, or in the third month, excuse me, and a margin of over 60%. It's fantastic. Now let's do the same thing for our limited monitoring model. Now what we're going to do here is we're going to adjust the assumptions around the percentage of patients that are billable for these codes. So typically what we'd assume is something more like, call it 25%, maybe 20% here, 20% here, maybe 25% here, and run the same numbers again. So, quite a bit less staff time required, and there's less revenue tied to it, but still a very good profit margin. And the overall dollars, are still pretty good. And I think the other side of the equation that we need to take into account here, if you do a limited monitoring model like this, is that you're probably going to be able to add more patients to the program because you won't have to dedicate so much staff time to that. So the other assumption I like to tweak when we look at this aspect is actually our patient numbers. So let's say that instead of 100, we're able to actually do 150 a month because we have more availability to do that. So then you're up to call it 20,000 of profit there in the third month. Okay, so a little bit less, but again, a lot less work. Now the last one we'll look at here is the outsourced pricing model, outsourced staffing model. So I'm going to go back to the assumptions we had before around the time that we spend, but then layer on a little bit more cost here for the staff time. And that's because we're outsourcing it and we're doing this on demand basically. So really taking a lot of the responsibility out of your hands there. But let's bring these numbers back down a little bit in terms of the new patients, for now. So we'll see that's at $23,540 and a 44% margin. Still very, very good, very healthy. And you know what? I think because we're outsourcing this, let's it's not quite as hands off as per se the limited model, but let's just say we have about 125 patients. So we're kind of right in the middle there. So there we are at $29,551 of margin opportunity for the outsourced monitoring model. So pretty good numbers there. And as you can see, these are all good profit margins, significant revenue and profit increase for you, just different ways of doing it. So now why don't we return back to the presentation, and we'll show you some other insights around this topic. So now that we've gone through the different models and you've seen how each of them can be profitable for your organization, I'll show you some examples of actual clients executing these models profitably. So here's an example of our client CoreLife, a fast-growing national physician group, which grew their remote patient monitoring program from zero to nearly $100,000 a monthly revenue with almost 500 patients. Now, given their care team model, they've used the in-house monitoring model to grow RPM profitably. They've had a lot of staff there to do that. And we're continuing to grow their RPM program together. And look, you can really take some of these revenue numbers that we shared and the calculations that I showed you earlier and extrapolate them for your patient population. We've really seen this work well at all sizes. And just to follow on from CoreLife, here's a quote from their RPM lead highlighting the success of our partnership and helping them grow their business. Just very proud of that. And furthermore, here are examples of testimonials from other clients of different sizes, independent practices up to health systems, highlighting their ROI, their profit through the RPM program. It's great. So now I'll answer a few common questions around this topic of making RPM profitable for your healthcare organization. So first off, can I take advantage of these services with my current staff? Absolutely. So as we just went through, your current staff can use underutilized time to deliver these services, or you can have part-time staff add hours. And as we demonstrated with the profit calculator, this ramp up is profitable. Next, can I take advantage of RPM even if I don't want my own staff to deliver it? Yes. So as I showed you earlier, we have an outsourced provider partner who can deliver RPM based on your referral. So all you need to do is introduce it to patients and then refer them to us for the monitoring. Next, does this work if we use outsourced billers? Yes, absolutely. It works with both outsourced and in-house billers, and our RPM billing experts will guide them either way and really make sure that you get paid and that you can really capture that profit ultimately. Can I ramp up quickly if I have a big team? Yes, absolutely. So as long as multiple staff members can train at once, this is no problem. We've trained up to, I believe, 30 staff members at once, very efficiently. So I hope this video has been helpful. And for those of you that are not familiar with us, over the past 7 years, CoachCare has worked with thousands of healthcare systems, physician groups, and independent practices to support their virtual health and remote patient monitoring needs. To learn more, all you need to do is schedule a Q&A and tour of our technology. I'll answer all your questions about RPM, and together we can use our profit calculator and we can walk through how much you can make by implementing RPM. And there's a link to book a call alongside this video. Thank you.